Good afternoon, and welcome to HealthSystemCIO.com's All-Star Panel, Vanquishing the Data Management Dragon, a webinar tweet chat combo from HealthSystemCIO.com, sponsored by NetApp. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief of HealthSystemCIO.com, and I'll be your moderator today. We are having a simultaneous tweet chat hosted by Kate Gamble, our Managing Editor and Director of Social Media. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can view the the tweet chat in the Media Viewer panel on the right-hand side of your screen. Other WebEx panels we're going to use today are our Q&A panel. You can use that at any time. Submit questions as they occur to you. We will take those later on in the program. Leave the default set to all panelists. We're also going to see if we can work a poll into our event today, and that polling panel will automatically open when we launch the poll. And you can use the URL on your screen to download the deck. That URL is also being sent out in the chat box, and it's at the bottom of our slides. Just so you see how we're going to spend our time today, we're going to have our panel discussion first, featuring Lynn Witherspoon, System VP and CMIO at Ochsner Health System, Oscar Perez, VP of IT at Memorial Healthcare System, and Joseph Hobbs, Senior Manager, Epic Alliance with NetApp. So without any further delay, we are going to jump right in. Lynn, can you give us sort of an overview of Ochsner?
Sure. Briefly, we're a large integrated health system located in southeastern Louisiana. We own and operate 12 hospitals in that system today. There are 1,300 employed physicians and another 700 or 800 advanced practice practitioners in practicing in all specialties in about 40-odd health centers. We are today the nation's largest transplant center, interestingly, and are pretty proud of the impact that we're making here in a state that seems to be always dead last in terms of outcomes and number one in terms of costs.
Very good. Thanks, Lynn. Thanks for joining us today. Oscar, a little bit about your health system.
Great, Anthony. Yeah. My name is Oscar Perez. I'm the Vice President of IT, and I work for Memorial Healthcare System down in South Florida. We're a 6-hospital healthcare system with a children's hospital known as Joe DiMaggio Children's Hospital. We have about 250 employed providers, about 1,500 on staff. We're about $1.9 to $2 billion organization. We're a public organization down here in South Florida, probably the 3rd or 4th largest in the country, and we have a very patient, family-centered care approach to healthcare, and we strive to be the most technologically advanced in our area as well. So glad to be here.
Very good, thanks, Oscar. Joey, a little bit about NetApp.
Yeah, so thanks for having me. My name is Joey Hobbs. I am the Senior Manager, and I manage today our Epic Alliance with NetApp. So I've been at NetApp about 3 years. Was a former healthcare CIO, like many of you on the phone. So NetApp's a $6+ billion company. We're the #1 independent data management, data storage company in the world. From a healthcare vertical perspective that I work in, we're about 10% of the company within the Americas business and the fastest growing vertical within NetApp's business. So doing a lot of great work with a lot of great health systems, and look forward to the conversation today.
Excellent. Oscar, let's start with you on the next question. Describe your data management environment, how things are today.
Yeah, I think we have over 300 plus systems here at Memorial Healthcare System, and so from a data perspective, we have quite a lot of data floating around. We put a lot of emphasis on controlling that data at the actual systems, but as we all know, we do a lot of extracts and interfaces and data flows in and out of our systems, and that tends to be a challenge quite a bit. You know, being in healthcare, obviously you have to worry about PHI data and sensitive data, or PCI data on the financial side. So we have you know, we have a big task in front of us. We're always being asked to share as much information as possible, but also to keep it as secure as possible. And those are kind of diametrically opposed at times, but we do have a lot of our data, you know, although it's stored in our data centers and on storage equipment in our data center, we have been moving more and more towards the cloud. And again, as I mentioned earlier, we have a lot of data that not only resides in the systems that we have here, but a lot of requests and access for that information to be sent both internally and externally abroad. So I would say we have a, you know, a complex data management environment, and never static, always ever changing, and I think that's what makes you know, some of our jobs here a little bit interesting, to say the least.
Yeah, good word, interesting. Lynn, you want to take a crack at that? Talk a little bit about your data
Sure.
management
you know,
environment.
We could certainly echo the complexity of our environment, and as a clinician, I'm going to tend to sort of think about the topics we're talking about from a clinical perspective, if I may. And I would reflect that our data management environment today is local. It is user-centric. What we know is derivative of our own operational platforms and or clinical documentation. If you think about the electronic health record environment as being the largest and most significant artificial intelligence platform that we have, pretty much everything that we do there is about data quality, or it's about clinical decision support, or thinking about how to do better. And perhaps we would understand this in the context of the machine becoming more like a colleague, to emphasize again sort of the humanness, if you will, that we would desire in the context of the user environment that our electronic health records bring to us. We do here do a lot of analytics in the background. Analytics at the point of care is limited, and as we'll talk in a minute, you know, what might this look like somewhere downstream is a little different than it is today.
Perfect, and that does take us to our next question. And Lynn, I'm going to let you continue. Describe your data management philosophy. So we talked about how things are. How do you want things to work, and where are you looking to make changes or improvements to sort of get there?
Well, you know, today's data management environment is carefully crafted to support the business and operational needs that we have today. So it's very much about transactional activity, individuals, encounter-based activity. And as we're all you know, sort of confronted with this volume to value or value-based care transition, we begin to think about populations. That leads us to needing information management that gives us statistical and directional information about populations. Maybe the data that we have today is good enough for directional statistical kinds of things. When it comes to individuals within that population, it's black or white. It's very binary. You've either got it or you don't. And we'll talk again, I think, later about the need for better data, not so much big data or rapid in-flight data or volumes of data or whatever, but the challenges around data. The paradigm needs to kind of flip on its head. This needs to be patient-centric in the future, and probably much less about what we have in our own data centers as about our ability to access and be able to understand what's happening with patients wherever they go, wherever they present for care. And while we throw this term interoperability around quite flippantly, the fact is we can't really do that today, but that's sort of what the future vision might look like, I think.
Very good. Oscar, you want to tell us sort of where you'd like things to be and things you might be trying to do to move in that direction?
Sure. I think that, I guess my philosophy or strategy there would be, in a perfect world, right, we'd get the data would be available to us at any time in any format, securely delivered to us wherever I am, and so that's a big audacious goal to be able to have that. But it's the truth, right? I think our executives and our patients and our physicians, everybody's mobile nowadays, so you need to get this data to them wherever they're at. It's no longer just sitting in front of a computer connected to a network that's in your organization. We also try to get, we have this goal that we try to get our, least access data on lower cost storage or, less expensive solutions. But that's a huge task to be able to identify the data and being able to properly categorize it and all of that. As far as challenges and improvements, I would say that our organization has tried to go through some data retention initiatives, and the truth is that the reality of it is that most everybody wants all the data online all the time, and I try to identify which ones shouldn't be online or should be destroyed and removed. The only people that are really asking for those to be removed is our legal department. So for liability reasons and things of that nature. So that's that's one of the biggest challenges, and we've encountered that over several years. Is how do we determine what's the right data and how long do we need to keep it for, and all that, as well as the continuous, as I mentioned earlier, the continuous need to keep this data secure while you're sharing it with others, and while it's at rest, or while it's in transit, or while you're, whether the patient's requesting it, whether another facility or physician is requesting it. How do you continuously keep the custody of change of that data, auditable and being discoverable and all that. So it's a constant struggle and challenge. And I would say too, a third there would be duplication of data. We have the same data duplicated. We can't even count sometimes, because it'll be in our EMR and then it's sent somewhere else. It's in some reporting system. It's in our data warehouse. It's sent to registries, external registries. So how do you contain this enormous amount of data that also is duplicated several times over while keeping it secure, while keeping it audible, and all that, I think, is super important. And then I think, as Lynn mentioned, not to add any more complexity to that, but with population health or value-based care initiatives, now it's not only your data that you're being concerned about, but now you're bringing in all this external data from other organizations where you weren't even necessarily the originator of that data. Now you're bringing in and commingling it with your own organization's data. So the challenges are fruitful, and but as I mentioned earlier, I think it's nothing that's insurmountable. It's quite a bit of challenges that we as an industry continue to struggle with every day.
Let me just follow up with you, Oscar. You mentioned the propagation of data throughout an organization where you have the duplication, the same data in multiple places. And then do you then have the challenge of not having one source of truth, so to speak? You've got changes in that data at different places throughout the organization, and it no longer matches what was the same and duplicated, now is different, and we don't know which is the correct one, the most updated one, these types of problems.
Yeah, that's definitely a challenge with that. I think that, you need to, as an organization, you need to have, it sounds cliche-ish, but you need to have good data governance. You need to have good, master data management. You need to be able to know what are your sources of truth and have them documented and have them, well laid out, and educate the staff as well, because it is difficult as you get data from one system into another, and then there's potential manipulation of that data for various reasons. How do you continue to maintain the integrity, and how do you have the users of this data remain confident in its efficacy and its that it hasn't lost any sort of integrity. And it's all within, I think, how you manage your data governance. How do you ensure that reports are coming from a trusted source, and ensuring and again, not to limit operations and other workflows from being able to access that data, but again, having good governance and good governance over the data, I would say, is critical. And I'd say it's not the sexiest thing, and it's not the most, I would say our executives in general, I think, are not necessarily always thrilled with data governance, because it does put, it takes a while to get the organization to buy in and explain it and the benefits of it. But I think at the end of the day, it's a crucial element in making sure that the data is, maintained its integrity throughout.
Very good. All right, Joey, let's bring you in here. As a vendor, you get to work with lots of customers. So what have you seen as some best practices and common mistakes out there dealing with a number of entities?
Yeah, thanks. So one of the things I'll touch on first, and listening to Lynn and Oscar talk through some of the things from a best practice perspective, the organizations, and you would be surprised by the number of organizations that don't really have a strong strategy. So we have data management in two things, right? We have application level, so whether that's within your EMR and how you're handling governance between departments, and then you have organizational data, so from a storage data management perspective, and that can mean a lot of different things. Lynn and you guys talked about, we're looking at a cloud strategy, we're pretty much on-prem. I mean, that's still data management, but much different than an application level. So strategy to me is a key piece. I think it was Oscar who mentioned they're looking at how long is the life of the data. So, one of the things, and that we want to put it on the cheapest possible storage when we can. So one of the things that I look at and we work with customers on is we have some tools. You look at like PACS data. I mean, PACS data after the first 30 days, 95% of it's never looked at. So putting that on the cheapest possible storage makes a lot of sense, and we're building a lot of our solutions to be able to help customers do things like that. The other one I'll talk about a little bit from a best practice is working with large organizations going through mergers and acquisitions. I've seen everything across the board from very well-run organizations who immediately when the discussion starts to take place on whether that's a merger or an acquisition, they're identifying, I think Lynn mentioned they have 500 applications. So if you're merging with another hospital of near similar size who has 500 applications, how do you identify what you both have and what the overlay is and what's in each data center? And there's some organizations we work with who do a very good job. They have some tools they'll put in place, and they can identify exactly what assets are there and really where those synergies are. And on the flip side, I've certainly met with organizations who their plan is to let the other data centers sit for 3 to 5 years, and as assets die, that is the plan. While probably an effective plan, a much more cost prohibitive plan, and being able to really integrate, and not only from a cost perspective, but if you look at application integration and if they're regional, local organizations, there's certainly benefits from probably financial and patient and quality management and all those things that could exist. So those would be the kind of two things I really look at. Common mistakes, if you look at as an industry, we design data centers to support applications. And what I mean by that is we had a PAC system, we went out and bought a storage array, and that's what sits on it. And we went and bought an EMR, and that sits on a SAN array, and it's different, and that's what we manage that with. And when that starts to become difficult is now we have 500 applications, and certainly some are on shared infrastructure, but we've created these silos across our organization that then lead to migrations and downtimes and all these things that clinicians and end users certainly want nothing to do with. But it's also very costly to the organization and having to manage the life cycle of all these different silos we've created throughout our organization. And I would say that's the majority of what we see still in healthcare today. We're cloud resistant, which I know we'll get into a little bit later. But I think those are some of the common mistakes I see in a lot of organizations figuring out, okay, what do I need to do to become like a cloud provider and simplify how I'm going to manage all this data? Because you're right, not only, I think it was Ochsner who mentioned the interoperability and bringing in data from outside organizations, now we're talking about bringing them in from Fitbits and Apple Watches and outside patient things that aren't even other organizations. And what are we going to do with all this?
Yeah, we're going to get to that a little later in the program, talking about some of those Fitbit issues. Let me bring Lynn back in here. And Lynn, you said you've got that MD clinical hat on. So talk about the relationship between data management, data quality, and clinical excellence. How do you wind up with actionable, high-quality data at the bedside that clinicians have the confidence to base life and death decisions on? Maybe I'm being a little over-dramatic, but anyway, your thoughts there.
It's all about the data. Yeah, let me reflect on just a couple of things here.
Sure.
The healthcare data is really messy, and as we talk about the number of source systems and the rat's nest that the integration engine is, and moving lots and lots of data from one place to another to be able to try to make sense in local environments of what's going on. We've pretty much adopted an integration strategy, if you will. So our core electronic health record platform is the target for any clinical application, and coming from a quintessential build-it-yourself, best-of-breed environment into if the core platform can offer the service, then that's really what we want to do. It does create a common set of core system files. It puts us on one single backplane database, and it does create at least some consistency in the data environment. That said, this notion that anything anybody needs to take best care of any patient, no matter where you are or where the patient arrives, is incredibly challenging given the way that we have approached this today. And the future direction would again seem to be a more patient-centric approach to the data environment and the data management environment, as opposed to we thinking we have to centralize all this stuff in our own environments. Think a little bit about the community CHIN efforts of years gone by, or the HIE efforts of today. The enormous cost of that, the relatively small subset of relatively poor data that those systems are able to aggregate, and our inability really to run meaningful population applications on top of those kinds of data structures, as opposed to it becomes more about the patient being the center of the collection of all this. Maybe just one more little anecdote, Anthony, and I'll get out of your way. But
take your time.
Karen DeSalva and I were chatting about this at a Connect Louisiana meeting a few weeks ago, and she said, well, so how about blockchain? And, some of you all know that ONC has thought a little bit about this problem of why don't you leave the data where it originated instead of trying to centralize and move it all around. And I said, well, it's really about the register. And then it occurred to me that, maybe patients would be willing to be custodians of the register. That is the list really of where all the data are, as opposed to attempting to, and pointers to the data, as opposed to trying to integrate the data. But I'll come back to this question that you asked about how do we try to optimize what's happening at the point of care a bit later, but I'll tease you to say it really is about the data. And ultimately, we've got to do a better job of representing what's really happening at the point of care.
Very good. Oscar, your thoughts on getting some real quality data to the bedside?
Yeah, no, I couldn't agree more with Lynn. I think that, you know, there's so much volumes of data that are captured in our EMRs, both structured and unstructured data. And I say the EMR because you know, the EMR is the best vehicle to probably deliver this high-quality data to the clinicians at the bedside in some shape or fashion. And I feel that, you know, in order for it to be actionable, it has to be built into the provider's workflows, right? It can't be, you know, be at the bedside and then go log into this other computer and log into this other application to get to the data that you need. You need to have it really seamlessly and intuitively built into the provider's workflow to be able to be, you know, actionable at the point of care. But the precursor to that is that we capture so much of this structured and unstructured data, whether it's from other providers, whether it's from nursing, whether it's for regulatory requirements, or whether it's copy-paste, or whatever the case may be. We have just globs and globs and globs of information, and it's really up to our, you know, our EMR vendors and our application vendors to be able to parse that and again, deliver it to the end user and reduce the noise of all this data and only present the data that the physician needs at the point of care to make whatever decisions they need to make on the you know, for the patient, whether it's life or death decisions or ordering decisions or whatever types of decisions. So I would say that you know, that I think that it's got to be built into the workflow. And I also feel that from a quality perspective, you know, the more transparent we're becoming with this data, whether it's, you know, more sharing of the physician notes, whether it's the patients or the consumers having access to all this clinical data and them questioning it and ensuring that the data is accurate and, you know, as clean as possible. I think that that's a key part to that sort of quality of the data because, again, we capture a lot of this data for a variety of different reasons, and sometimes whether it's being carried forward from, you know, from encounter to encounter, or it's just being brought in a variety of different ways, we need to ensure that the data quality is good, and I think transparency is a key to making sure that data quality remains high.
Very good. All right, Joey, let's go back to you over here. In your past life as a hospital CIO, how did you grapple with some data management challenges?
Yeah, I mean, I look at a lot of this stuff and listen to Lynn and Oscar talk. I mean, and I was fortunate enough to, or unfortunate enough to get out about 3 years ago from that life. But, you know, we spent a lot of time. And I agree, an EMR is a giant repository for data, right? I mean, that's what government regulations forced. And so the next evolution has been, so now what are we going to do with it? And we start to look at analytics and these things. I think we have to look outside of the box. We had done some pilot programs to work with different vendors on, you know, predictive analytics and some of the startups groups had nothing to do with healthcare. They just believed, you know, if we look at 3 years of history, we'll start to find things we may not have identified before. So, you know, I think a lot of my perspective, you know, came from there. And then again, when I was sitting in the shoes, there's a lot of things I know now that I wish I would have known. I'm fortunate to still work with my former organization and a lot of other organizations here in Indiana around, you know, some of the stuff Oscar talked about and how do we tier things to cheaper formats and how do we take some of these things other organizations are doing around the country from a data management perspective and implement those same policies and procedures in our own organization.
Very good, very good. All right, Oscar, let's start with you. Healthcare has tended to stay behind as we see many organizations looking to take advantage of the business benefits of the cloud. And you mentioned the cloud earlier, what is your organization considering from a technology perspective to reduce costs and enhance business operations?
Yeah, no, that's a great question. You know, I have this saying around here that we, you know, we in healthcare IT are fortunate because we're in an industry where we could easily predict the future just by looking across at other verticals and other industries, because healthcare does tend to lag behind, tends to be a laggard we eventually catch up, and parts of it is because of all the regulatory requirements and all the different stakeholders involved in healthcare, but we tend to be a laggard, and I think cloud is a good example of that, right? And in our personal lives, we don't buy movies anymore, we don't buy music anymore, we subscribe to some service that gives us all these great things. In other industries, cloud has been adopted way early on. And I think healthcare, because of all the concerns of privacy and security, and rightfully so, it's been a little bit slower to be adopted, but vendors are now signing business associate agreements. Cloud vendors are being more open to their, T's and C's and their SLAs when it comes to cloud, and having the right healthcare grade cloud environment. And so I think that since that's been taking place, I feel like some of the more progressive organizations, I know a couple in the area here that have taken a cloud first strategy. So when they're looking to purchase an application, when the question comes up of do you want it on-premise or cloud, they're going to always choose cloud. And from my perspective, from our organization's perspective, we do tend to be progressive. We do have a strategy when it comes to the cloud, and it's a very calculated, precise strategy of how we do that. Making sure that again that we're signing the right contracts, ensuring we have the right terms in there, making sure we have the right partners in there, making sure that the data is secure in there. But I think it's inevitable. If you ask me personally, I think it's inevitable and I tell some of my colleagues that in the next 3 to 5 years, if I'm still buying iron or some of this some of these systems on-prem, then just take me outside and take me out of my misery. But I do think that it is inevitable, and of course, bigger organizations, risk-averse organizations are going to take longer and take more calculated risks down the line. But and as cost pressures, are put on us every day, I'm sure Lynn and Joseph can attest to this, is that every day we're asked to do more with less, reduce our expenses and our costs. And if we can do that, by shifting some of these services to the cloud and, eliminating some expenses that we would have on premise, whether it's resources or maintenance or just more effectively be able to manage this stuff, then it makes a lot of sense to do that. But again, you have to gauge your organization's willingness to take on risk, because there's risk and there's risk on having it on premise, and there's risk of having it in the cloud. And again, you got to ensure that you have the right strategy and the right partners as you're doing this, if you choose to go down this path, so that whether your data is in the cloud or on premise, you're still responsible for that data. And whether it's on the cloud or on the premise, if there's a breach or if there's any sort of issues, you're still responsible for it. So it's not like you're shifting liability. You're still responsible for that, and so it's just really somebody else is hosting your information.
Lynn, your thoughts?
Yeah, I think there are a lot of reasons why we've sort of resisted or been hesitant to move processing to somebody else's computer, as the case would be. Some of that is because some of us had not such great experiences doing that 10 or 15 years earlier. The phenomenon of having to add physical devices every time one brings new applications into the environment, the vendor says, well, my FDA certification requires that we do it this particular way. And so there are I think a lot of reasons why it has evolved the way that it has. On the other hand, we were here just in this past week talking a little bit about the woes of budget and the notion that these are parallel curves. As we grow, the IT cost pretty much parallels that growth curve instead of being able to leverage and bend that. And I said, well, we keep doing the same thing over and over again and expecting some different outcome when pretty obviously things like a cloud strategy potentially could help us be more economical as we think about resources that we need and how we're going to acquire them. And I do think that cloud in particular is the largest opportunity that we haven't really harvested that has an opportunity to make a big difference. in that budget curve, at least as far as it relates to physical infrastructure. So the future needs to look different than the past, or we'll just keep getting the same answers.
Well said, well said. Joey, do you want to talk a little bit about the reluctance that you see some healthcare organizations having to the cloud, and any thoughts you had on those concerns?
Yeah, so one of the things I think certainly for years Oscar mentioned is regulations, right? It was the large cloud providers weren't signing the BAAs or the T's and C's that were required from healthcare organizations. We've certainly seen a shift in that. I see a lot more customers having very deep conversations with someone like Microsoft Azure because part of your ELA has so much storage in Azure, and they're really putting a significant healthcare focus. You know, you bring up cloud, and it's more like a fog, right? Does that mean private cloud, public cloud, hybrid cloud? We've got all these different scenarios. The thing I look at and I see the most is people are typically the reason that they move to the cloud is there's a believed that there's going to be a cost savings. And to truly find a cost savings, you've got to look at a number of things. Maybe I'm running out of data center space. Maybe, you know, an investment in people and a lot of different things to find a cost savings, because pure dollar for dollar, it's not a cost savings. But the other thing I really find is organizations who, you know, struggle to find the people they want and need in a local territory to support their infrastructure. And so it is worth more money to them paying someone else to do it. And essentially, you know, the cloud is just your data in someone else's data center, regardless whether that's public or private or wherever it's at. And it's interesting from a timing perspective. We recently held an advisory council for our healthcare group here at NetApp, and one of the things we offer as a free service to customers is what we call a service design workshop. And really what that is we come in, spend time, and work with organizations to analyze what their data is. So the easiest path to the cloud for organizations that are looking to just start is this stale data that we don't really, you know, use. You have 500 applications. How are you going to even identify what you want to put in the cloud, or what's the best opportunity to do that? So we have tools that can help identify that. But the other piece I see more and more organizations is they want to become the Amazon or Azure to their organization. So I want to provide SLAs. I want to show application performance, you know. And so having tools and strategy and processes in place, again, it's a free workshop that we offer, and since our advisory council last week, there was 7 organizations who scheduled those because that's what they want to be to their organization. And right now, we had this discussion of we as IT have become just a cost center because we don't do a great job of showing the cost savings across the organization that an EMR is providing. So an example, you put in Epic or Meditech or Cerner, and now you're able to implement quality rules that's driving down, let's say, sepsis by 40% or whatever that number might be. There's a huge cost savings to that we didn't have 5 years ago, and now with the EMR. But we don't do a great job explaining to our organizations that the EMR is not just a cost center in IT, it's helping drive outcomes and cost down in other areas of the organization.
Very good, very good. All right, we're going to put out a quick poll. Take a look at this, and then we're going to have a discussion about this topic. If any of your vendors experienced significant outages in the past year, did it cause you to change business continuity policies, procedures, or planning within your organization? Yes or no? So if you could just take a second and answer that, we would appreciate it, and then we'll take a look at those results. Once again, if you had a vendor experience any outages, did it cause you to sort of rethink things at home? And let's take that to our question. Some large vendors who provide software and services to the healthcare industry have experienced significant outages in the past year. Has that changed policies, procedures, or planning within your organization? Lynn, let's go to you on that one.
Sure, yeah. I think these are illuminating kinds of events. We realize that today a fairly large percentage of our younger staff never practiced with a paper chart. And so any outage along the way is significantly disruptive. The most significant external outage, major transcription outage that you all know about, caused several hundred of our notes to be sequestered for periods of weeks on end. The Joint Commission isn't very forgiving about that. They want the notes on the chart, and so thinking about how do we ensure that documentation is going to get where it needs to go, even when external contracted parties have difficulties and problems, was an important piece of our aftershock. When we talked with the vendor, we said, you know, maybe you ought to think about sequestering those in-flight notes someplace that's safe, so that if your central systems go down and you corrupt your backup platforms and it takes you weeks on end to get back online, at least we could get to the transcribed document.
You're always a gentleman, Lynn, right? Even when the crisis is going down. Maybe you can think about doing it this way. Oscar, your thoughts?
Yeah, no, I think that, events like that are always catalyst events that get your boards or your executives, asking lots of questions and a little bit more timid when it comes to, potentially dealing with that vendor, or if you're outsourcing or using them as a cloud vendor, or whatever the case may be. So it definitely makes you reevaluate your procedures and your policies when dealing with these vendors. But that's why it is important to have a strategy. And again, whether you're being hosted or one of these vendors, you're dealing with one of these vendors, and there is some sort of an outage of that nature, you need to, just like you would whether you're on premise or not, is you need to have the right downtime procedures and business continuity plans, and practice those, and do them every year, and make sure your folks are educated on it, because the same outages could happen to you while you're on premise, and they do. They happen all the time, right? Or not, hopefully not all the time, but they happen, at some frequency. So you need to ensure that that you have the right redundancy and the right procedures in place in the event that there is some sort of outage. And depending on the outage, it could be data center's down and you can access it from another data center, or both are down, or your network connectivity is down and you might have to go to paper. So it really depends. But I do think it does cause pause, and it stresses the importance of the agreements that you have in place with these vendors. Do you get credit back when there's outages? Do you get all sorts of different incentives back? And just to ensure that you have the right, in addition to having the right procedures and the right redundancy, ensure you have the right protections in the contract as well, to ensure that you have the right remediation for that.
Very good. All right, let's take a look at our poll results, and we see that 82% have instituted changes because of vendor outages. Joey, your thoughts on that result?
Yeah, I mean, I certainly can't say I'm surprised and listening to Lynn and Oscar. I mean, I think it was we've seen things with the ransomware and these things going in the organizations, and more people being hit. I echo Lynn's comments. Before I left the organization, we were unfortunate enough we had a data center outage due to an air conditioner, actually 3 air conditioners, AC units going out, and we called a code white, which was our go to paper, and it happened to be on a day where there was also an ice storm, and most of the clinicians thought it had to do with the snowstorm. And you really learn some of the things about your organization quickly from education of people who, it's fortunate you haven't had one in a few years, but it's a lot about education and reviewing policies and what you do. So the number there certainly doesn't surprise me. I think we're certainly becoming more and more aware of, what are we going to do in these outages? What are we doing to protect our backups? And what's the frequency? We have a lot more conversations in the last 18 months about what does your backups and your recovery look like because of these outages.
Very good. All right, Lynn, let's go with you on this question. How do you plan to take advantage of all the new external and patient-generated data that is coming into healthcare to help patients and clinicians, such as Fitbits and these type of things?
Yeah, I indicated at the outset here that what we know about patients today is what's in our EMRs, and that's derivative of 2 or 3, 15 or 20-minute visits over the course of a year, when what's really happening with patients is largely invisible to us, except in the context perhaps of some of these environmental factors and or information transmitted from patients' homes. We do here happen to have a large telemedicine presence. We also have home monitoring for congestive failure, for diabetes, and for hypertension, and realize that being able to understand what's happening in patients' environments is clinically extremely valuable. We also realize we don't really have infrastructure to manage these large boluses of data that are coming back, and how one is going to interface with that, be able to sift through that and find the needles in those haystacks is a looming challenge as we think about lots and lots of data coming to us from outside sources in the future.
All right, very good. We're going to keep things moving because we only have a little bit of time left. And Oscar, we'll start with you on this. Epic is demanding that folks move to Flash by 2020. Do you believe that the increased performance will change end-user satisfaction or play a part in patient outcomes?
I would say yes. I would say yes because, I mean, as far as patient outcomes, I mean, maybe that's a little bit like a softer yes, but I would say that moving to flash drives by 20, we already moved to flash drives for all our Epic production environment, and I can tell you there was a huge, considerable performance increase when we did that. And of course, it's expensive, although flash, drives are going down in price as they become more ubiquitous. But I would say that yes, it's something where we've seen a dramatic, huge, and it's something that we were measuring from the very beginning. So if you can visualize, a nice little plotted graph where all of a sudden there's a huge dip down in time to, access an I/O throughput, which equates to better performance. And we had, for a while there, we had our providers, committees and task force that were, they were complaining a little bit about the performance and, that things were taking a long time. And so once we switched to all flash drive, that drastically improved it, and we haven't had any performance issues to date since we've done that. So as far as patient outcomes, I guess you could make the argument or the leap that if providers are, not having to wait for information and things of that nature, that I think it could improve that, but it's probably a little bit of a stretch.
Joey, let's go to you on this one.
Yeah, so I completely agree. I mean, Flash is certainly, and I don't think it's just Epic, it's all these Tier 1 applications and EMRs. Where I'll say I've seen the biggest tie back to a patient care perspective is imagine these large complex reports that are running analytics, and maybe you have a patient on the floor who you're running quality management daily analytics against, and now because of system performance increases, a report that was taking 12 hours is getting done in 2, and maybe something happened in that 10-hour period. Again, never certainly know and hope that's not the case. But what I've seen from our ability, you look at from an Epic perspective, the Clarity database and a lot of the different analytic tools that are out there, we're seeing significant increases in the time that you can get output by increased system performance. And I think there probably is some direct tie to what that's doing to a patient outcome. And also, from our perspective, we look into some different management tools about spinning up new databases and quickly being able to rapidly do things for informatics staff and quality staff, and being able to create this environment that it's very quick to fail and allows you to then begin to look at something a little different. And I think more like research organizations are certainly taking much bigger advantages of technology we can use now because Flash has enabled better performance.
All right, very good. We're going to go with this one last question, and we're going to give everyone a chance to answer. We'll call this a little bit of a lightning round question. Please offer a key challenge for listeners. What do you challenge them to go back to their health systems and do as it pertains to our discussion today, which will improve how IT supports patient care, business operations, or both? Lynn?
Yeah, I'm going to suggest that in this transition from volume to value, all of our organizations are contracting with payers to, and promising to provide information about how well we're taking care of patients that they're paying the bills for. I would suggest that everybody ought to go home and think about what they promised, what those metrics look like, understand what the value sets that define the denominator, who's in the population that we're talking about, the numerator, how do you get credit for the fact that what you told the payer you would do, you've actually done, where in the documentation flows, where in the workflows those things happen, and then be certain that your clinical staff are clued in as to how this really works as well. At the bottom of the day, it ought to be tied to better care for patients, better continuity of care, but there's certainly a financial challenge here that says we better get much better about being able to measure what we're doing, understand how well we're doing, and iteratively improve that.
Excellent. Oscar?
Yeah, again, I couldn't agree more. I think that, I guess I would challenge folks to look at their data management strategies, look to, understand where all your data is and where you're sending all your data. We put so much effort and emphasis on controlling the data when it's in the applications, but again, there's so much data floating around. So I challenge you to look at that and ensure that you know where all your patients' data is at all times if possible. And then I would also say to, evaluate your core competencies as a healthcare IT organization, and as you're getting squeezed for resources and dollars, choose the core competencies that you feel are a competitive advantage and are a differentiator in your market. And, if there are things that you can, if there are things that vendors can do, whether it's hosting or cloud, that although you can do and you might have a passion for to do, but they can do more effectively and cost efficiently, I challenge you to look at that and not stay necessarily with the status quo, because that's kind of what's worked. So it's a great conversation today, guys.
Excellent. Joey, we'll give you the last word.
Yeah, and I'll just tag on to Oscar's last part there. I mean, I would challenge organizations to make sure you have a cloud strategy, and if you have one that's not been reviewed in a while, the times of being a laggard from healthcare to cloud, I think, are quickly going away. And it may still be that your cloud is an on-premise cloud, but if you're going to be an on-premise cloud, make sure you're delivering service much like a cloud provider would, and work to identify the places where you can use the cloud, but have a clearly defined strategy on what that's going to look like, because you don't want to be 2 to 3 years down the road where you significantly hindered your organization by thinking this wasn't going to be an applicable part of healthcare.
Excellent. That was a great conversation today, gentlemen. When you do close out your WebEx window today, you'll be taken to a post-event survey. If you could answer that, we'd appreciate it. Regarding continuing education, attending our webinars gets you 1 CEU towards the CHIME CHCIO certification program, so let CHIME know you were here. And if you've asked us to do so, we will. For a certificate of attendance for another CEU program, you can use the final slide in this deck. Just print it out and use that, or send it over and somehow. You will receive an email when our archive recording of today's event has been posted to our YouTube channel. If you'd like us to produce a webinar on the topic of your choice, you can contact Nancy Wilcox from our team, and you can go to our website to see our upcoming schedule. So with that, I want to thank our panel very much, Dr. Lynn Witherspoon, Oscar Perez, and Joey Hobbs, and I want to very much thank NetApp, our sponsor, for making this great conversation possible, and I want to always thank you, our attendees, for joining our events. So everybody, have a wonderful day. Thank you.